Hi, everyone. Good morning. Good morning. Okay, so I'm Latrice Smith, as Christy mentioned. I'm the eligibility and waiting list manager, and I had the pleasure of working at the state level on a work group to help develop this rule and these changes. So there were people from various county boards. There were individuals, advocates, professionals. We tried to look at things from a variety of perspectives so we can get something in place that'll work and be able to meet the needs of the individuals we serve. Uh-oh. All right. So there is a new waiting list rule, and the rule is the statewide criteria that governs how we manage the waiting list. And starting September the 1st, the rule as we know it is going to change. And so today, I'm not going to go into the entire rule line by line or anything like that, but what I want to tell you guys is that it's available for anyone. It's public record. If you go on the Ohio Developmental Disabilities website and look under rules under development, you'll see the waiting list rule. And there you can read, all the details, the fine print, everything you want. Today, my goal is to kind of provide that to you in summary form so you can basically know some of the major changes and how that'll impact you or your loved ones. I never have technical difficulties, but today I am. Okay, so background. So a little bit about the way the rule operates currently. So the current waiting list, let's be honest, it can be confusing to families. So how many of you received those annual notices that tell you your position on the waiting list, and then instead of the numbers going down, they go up? How many? Yep. So that's very confusing. And there was reason behind that. There were different rules we had to follow as far as people being a priority because of, a certain situation or becoming an emergency, which will bump you up or down. But the reality is that was very frustrating and confusing to families. And most families, like anyone, you would expect to progress on the list. So if you've been on there for 10 years, you would expect, after 10 years, you'd be number one by now. But sometimes you would go down instead of up, which was confusing. We know that. Another thing is the waiting list rule wasn't consistently implemented across the state. So all 88 counties, we had the same rule, but there was a lot of room for interpretation. So people did things a little bit differently. And how that impacted the families that we serve is that people move. So if you move from one county to the other county, you'd be like, well, wait, in this county I was this number on this list, and I didn't have to sign a piece of paper. It was just different across counties, and so we understood that as well. The biggest thing is that county boards were not aware of the people who were on the waiting list. So historically, all you had to do was call in and say, hey, I want to be added to that list. We didn't have to verify anything. You didn't have to live in our county, all these different types of barriers that were making our list long. So because people didn't have anything that they had to provide, we didn't know who was on the list. People would move, people would pass away, but we didn't know that because they never called and told us, but we couldn't take them off. So our list continued to grow and grow, which is why now it's approximately over 3,000 people on it. We don't want that because if we don't know who's on it, we can't really address the needs properly. One of the things you may or may not know is on the current waiting list, you didn't even have to verify that you had a developmental disability. So there could potentially be people on there who would never qualify for our services if their name came up for a waiver. At that time, we would figure it out. But in the meantime, it just made the list keep growing longer and longer and being more confusing. So there's one main objective of this new waiting list rule, and that's to not be on the waiting list. We don't want people on a list waiting for things. If there's a way we can meet your need, we want to do that. So we want to talk with people and figure out what it is they're waiting for and meet that need. The only way that we want to place a person on a waiting list is if they have a need that we can't meet any other way but with a waiver. So we know this is a big shift in thinking for families and professionals because sometimes professionals will say, hey, call Developmental Disability Services and get put on that list. And families are like, okay, but we don't want that. We don't want you if you don't have a need right now, we don't want you sitting on a list. And if you do have a need, we just don't want people sitting on the list. It's not helpful. So the new rule, it's going to be a new way of thinking. The emphasis is going to be on what you need, what services you're asking for, and not a funding source. So sometimes people say, you might hear people say, I want an individual options waiver, known as an IO waiver. That's what I want. I don't really know what it pays for, but people tell me that's what I need. That's not always the case. There are other services that can meet your needs. If it's something like a one-time service you need to help get your family in a place where they're comfortable and keeping your loved ones safe, we want to provide that. That may or may not be through a waiver. So the key is focusing on what the needs are and not necessarily wanting a waiver. We're going to focus on why you want that waiver and how we can meet that need. So we want to, with the new waiting list, be able to meet people's needs in a more timely manner. A little bit further down, I'll tell you about some of the things we're doing as far as an assessment, different things. So everyone will be able to, or be required to have an assessment to be placed on a waiting list. And because we're doing that, we'll know who's waiting and we can better plan for services. This is kind of what I said before, and I'm going to repeat it because I want this to really get through to everyone. When we meet your need, it may or may not be through a waiver. A waiver is not the only way to meet your needs. There may be local funding available to meet your need. There may be a community-based partner that we have that we can collaborate with to help meet your need. There are some situations, I'll acknowledge that require a waiver. So if you have a person who doesn't have any natural supports, they need to, in order to live independently, they need, independently and safely, I'll say, they need some in-home staffing or something to help with that. We know that sometimes if it's a person that needs a lot of support, that requires a waiver. We're not saying that, it doesn't. But we're also saying that there are some scenarios that don't require that level of funding, and to be open-minded into exploring those as well. So the solution. So some of the things that these are the things that will happen with the new rule. So the main thing we want to do is have uniformity across the state, all 88 counties. We want to make sure that all counties are doing things the same way because, again, people move around, and we want you to kind of have the same experience no matter where you're going. So there will be a statewide needs assessment. So the work group I mentioned earlier, we worked on this as well. And it's going to ask about very specific situations, criteria, scenarios. It's going to be looking at the individual's current services they have in place and also what their needs are and making sure that they are in a position where they can continue to remain safe in their environment. So I won't go through all of the criteria on the needs assessment. However, if you want to go on that website that I told you earlier, the first slide, and I can go back to that at the end if we want to, you can actually see the assessment, and you can also see some of the things we may be asking. But for example, one of the things that the assessment looks at is whether or not the current primary caregiver can continue to provide care to the individual safely. That the caregiver themselves doesn't have declining skills that's impacting the individual. We want to know that because we want people to stay in their home. So if we see that a person has a caregiver whose skills are declining and it's negatively impacting the individual, we may need to put some supports in place. So there will be a statewide needs assessment. All counties will use the exact same assessment. Another big thing is that you'll only be able to be on the waiting list in a county in which you reside. Now, you may or may not know that currently you can be on a waiting list in every county. Some people call each county and say, I want to be on every waiting list, and they are. And they say, whenever my name comes up, I'll move to that place. So again, That has worked for some people. However, for county boards, it's really confusing because we don't really know those people who aren't in our county. If they move, I don't think they're probably going to call every single county and give us an updated address, those kinds of things. We don't even know how to reach them. So the new rule, you will only be able to be on the waiting list in the county in which you reside. Now, that helps us because we'll know the people we serve and it just won't crowd the list as much. Another major change is that there will only be one waiting list. So right now, are you guys familiar? There's three. There's the individual options, the level 1, and the self-waiting list. There are 3 separate lists. So you called in, you say, I want to be on all 3. We won't have that anymore. So when you're assessed using the statewide assessment and it's determined you meet the criteria, you have a need to be placed on the waiting list, there's only one list. And what the team will do is actually look at you in your particular situation, what your specific needs are, and determine which waiver could meet that need. So for instance, if you have a person that we're serving and the only thing they need is a few hours of respite a week or something like that, that particular person wouldn't be enrolled on an IO waiver because that's for someone with a higher level of need. So they may offer you a level 1 waiver and not an IO. So it's going to, again, not focus. We don't want people to focus so much on the funding source and say, hey, but I wanted the other one. You really need to focus on whether or not the one that we're offering or the one that your team discusses is the one that can truly meet your needs. We also are saying the new list will also be more transparent. There will be a family portal that the Ohio Department of Developmental Disabilities is creating. That's a lot to say. And you guys will be able to log in and access, once you have your assessment, if you want a copy of that, and also just to kind of assure that you are on the list. Because some people might say, hey, I haven't heard anything in a little bit. Am I still on that list? We will no longer be sending out that annual notice. It was confusing. It just didn't really work that well. But you will be able to see that you do remain on the list. So because everyone is having a statewide assessment, and the only people that are going on the waiting list are those who may have a need based on that assessment, we will know the people on our list. And that way, we can be more thoughtful about our planning as a county board. We don't want to just react when something arises. We want to be able to plan with you guys because it'll help put families, individuals, everyone at ease if you kind of know what's going on. Now, we do know that there will be some situations that come up. We'll refer to those, I'll go into a little bit, as immediate needs. We'll have to address those as they come up. But for the most part, if we can plan instead of just being reactive, that's what we want to do. And I say this, the new rule is really to focus on need. That's the key. You're going to hear me say need 1,000,000 times. We really want to focus on what the needs of the individual are and how we can meet those needs. So the thing for you to know is anyone that's on the new waiting list after September the 1st, they will truly have been assessed to have a need. There won't be people on the list who may need something 20 years from now that aren't needing anything now. And that helps you guys because we can then work down it and actually address the people who have something going on now. So I'm going to define the words need a little bit more because I said it a lot. So you're probably like, what is that? So in the assessment and in the rule, there's 2 types of need that are described. There's an immediate need, which is, it means that there's a situation going on that presents risk of substantial harm to the individual if action is not taken within 30 days. So if we're meeting with the family or you call and there's something going on, some kind of situation has come up, and we're like, if we don't do something within the next 30 days, this individual is at risk of harm. An example of that may be, say a person lives with their parent or guardian, and the guardian falls ill or something. We don't want people, but just say that happens. It does happen sometimes. There's no one else to help. The person is going to be at risk of harm if we don't step in there and do something. that would be an immediate need. Now, that scenario can go one or two ways. If we say, you know, the person, their guardian is ill and we anticipate they're going to be that way for quite some time, say they went to a nursing home now, I don't know. That person may need a waiver to support them long term for them to stay at, live independently. Now, it could be a scenario where a guardian had a temporary incident occur. Maybe they had an accident, but they're going to recover. So in that case, we may put something in place like an emergency respite or something that would be local funding to kind of help during that time. But once the individual's guardian is okay, everything's great. So in that case, we may not offer a waiver. So the key that I want you to remember with this immediate needs does not mean that you're going to get a waiver. It's going to really be looking at what your situation is, your specific situation. But what I want you to remember about this is we think that there will be risk of harm if something's not done by the county board within 30 days. Action is not taken. Current needs. So this means that the individual has an unmet need for home and community-based services, another word for waiver services, that we anticipate will occur within the next 12 months. So on the assessment, again, there's very specific questions. If we know that within the next 12 months, there's a person who is they're in the custody of Children's Services and they're going to be emancipated, right? But they don't have any family. But this person's been living in residential facilities all their life. But in 12 months, they won't have Children's Services, they won't have anything. That particular person could be identified as a current need. We know that we anticipate that that'll happen within the next 12 months. There are no other natural supports. There are no local funds that can kind of help take care of that. So we're saying we might need to address that, but let's plan for it. Let's not wait until it happens. Let's go ahead and plan for that. So the difference with immediate need and current need is we anticipate you'll have a need within the next 12 months for current need. Immediate need, we anticipate you'll have a need within the next 30 days. It's a big difference. 30 days is not a long time to plan. So you might say, you know, I'm on this waiting list as we know it. How do these changes impact me? So anyone that was on a waiting list for any of those three waivers was placed on a new list. So on June the 11th, the state of Ohio froze the list as we know it. So if you were on our current waiting list, it was frozen in time, and they renamed that the transitional list. So everyone who's on our current waiting list will need to have the assessment I described earlier to see whether or not you would meet the criteria under the new rule to remain on the list. Now, I'll go through what some of the potential outcomes would be of you having your assessment a little bit later. But the key is to know that everyone on the wait list as we know it will need to have an assessment starting September 1st to see whether or not you're going to remain on the wait list. So the county boards have until December 31st of 2020 to assess every single person that's on the wait list. It's a lot of people. So we have a plan on how we're going to do that. So anyone who has a service and support administrator, SSA, case manager, you will receive a call on or around your next span date, your My Plan time, to set up this assessment. Now, your service and support administrator will not be the person completing this assessment. It'll be one of the people that Christy described earlier, one of the people from the team, the waiting list specialists. Don't worry, someone asked this question last time. We will consult with your SSA to kind of get some basic background information. We have all that covered, but they will not be the one completing the assessment. It will not be at the same time as your My Plan, because you all know if you have a My Plan, that can be a lengthy meeting. So on or around your next span time is when you'll get your assessment if you have an SSA. If you do not have an SSA, because there are a ton of people on the waiting list who do not, We will contact you by December 31st, 2020. So what I want to tell you is that you do not have to rush and say, I want my assessment now because I fear if I don't get it now, I won't get a waiver. Because during this transition period, the only waivers that the county board is allocating or giving out to families are those with immediate needs. So if there's one that comes up where it's that immediate need, something needs to be done within 30 days, and we say, oh, we really need a waiver for this, those are the only waivers that we're giving during that time. So you don't have to worry that, you know, your neighbor was assessed the day before you and then they're going to be ahead of you on the list. Don't worry about that. Another thing I want to say is that when we do these assessments for those on the transitional list, if you're assessed to have a current need and you're placed on the new waiting list, you'll keep your original dates. So if you went on the waiting list in July 1st, 1991, when you transition to the new list, your date will be July 1st, 1991. On the flip side, if we do your assessment during this transition period and it's determined you don't have an immediate need, you don't have a need that we anticipate will happen within the next year, you will then come off the list. However, what we tell people is that if your situation changes, anything changes, let us know. Especially for those who don't have a service and support administrator, because that person's in contact with you regularly. But for those who don't, we don't know if something changes if you don't let us know. So if something changes or significant change, call us and we can do a new assessment. And at that time, you may be determined to have a need to be placed on the list. If that is the case, though, please remember that your original date you had, you won't have that. You'll have a new date, which will be the date you're assessed to have a need. So think of this list, this transitional list, it'll go away completely. Because once you have your assessment, a few things will happen. You'll either go to the new list or you won't. So that list will disappear. This is just to help get the people who are currently waiting where they need to be. So once you have your assessment, there are 5 potential outcomes. So one outcome is that the person doesn't even have a diagnosis. So these are the people that we're going through, those 3,000-some people when we're doing these assessments. The first 3 questions on the assessment are, does the person have a developmental disability that's not solely mental health, that occurred before age 22, that's likely to continue indefinitely? So those questions may sound familiar. Those are the questions we kind of ask during your eligibility intake when you first join or come and become part of the agency. So if we're asking someone those 3 questions and they answer no to any of those, we don't go on with the assessment because they wouldn't even qualify for our services, and therefore they would not be put on the waiting list. So there are going to be some people who fall under this. So before, remember I said you used to be able to call and just say, hey, I want to be added to this waiting list, and a lot of people did. And so there may be people on the waiting list who just have a sole mental health diagnosis or something like that. In that case, we would then remove them from the list. Now, what we would do for that person likely, because we are helpful, we try to be helpful to everyone, is provide them with some contact information to an agency like a mental health agency that might be able to meet their needs. But as far as our list, they would not go on there. The next scenario or potential outcome is that the person is assessed to have an immediate need. So we're going out, we're meeting with someone, and we learn that this person's been at home by themselves because their parent got hurt and is in the hospital. We didn't know that until we went out and did that assessment. So this person may become an immediate need. That means the county board needs to take some kind of action immediately to make sure this person remains safe. So when someone is determined to be an immediate need, we don't put them on a waiting list. Because if it's a true emergency, why are we having them on a list waiting for something? We want to do something. We want to take action. So this particular person, the county board will step in and actually take some type of action to kind of mitigate the risk and make sure that they remain safe. So this person's not going to sit on a waiting list. We're going to do something. The next outcome is that you are assessed and it's determined that you have a current need. So we anticipate you'll have a need within the next 12 months. However, it's something that we can address with alternative community resources. So we do an assessment and we find out that a person needs some nursing in their home or something like that in order to be more comfortable and safe, right? So we also know that this person has Medicaid. So we ask them, hey, did you tap into your Medicaid, your state plan? You qualify for some hours of nursing through that. Did you try that? Oh, no, I didn't know that. We help get them set up with that. And in this case, their needs met. So therefore, because we do anticipate that there's a need, but we met it with alternative community resource, this person would not go on the waiting list because their need is now met. Now, later on down the line, if additional needs come up and we find that that's no longer keeping them safe or meeting their need, we can then maybe reassess at that time to see if they need a higher level of care. But for this particular person, we're saying, we met your need, so therefore you would not go on the waiting list. And again, the goal, remember, to not be on the list, to get your needs met. So, if you remember all the ones I just went over so far, no one got on the waiting list because we don't want them to, and we met their needs or they didn't have a need. So this person, we do an assessment and we determine, this person is going to need services within the next 12 months, but the only way that we can fund that, there's no way we can fund it with local dollars, there's too many services. There's no community resource or anything that can provide that. So we're going to go ahead and put this person on the waiting list so we can be planning and figuring out how we're going to meet that need. So this is the only scenario in which a person goes on the list. And that's what we want because, again, it's a person with a true need who is assessed to have a true need. So this person is then put on a waiting list. Now, what I do want to point out is if you're assessed to have an anticipated need within the next 12 months, that does not guarantee actual waiver enrollment within the next 12 months because we may need to work on getting some things in place. Waivers, we have to make sure that the county board has the funding and different things like that, which is why this is very helpful because if we know who we have waiting, when we're planning, budgeting, different things like that, we can see, oh, we have this many people waiting. We need to try to budget for this. It really is a helpful tool. This goal is to really help the individuals we serve. So the last scenario, we meet with the family that's been on the waiting list, and based on the assessment, they don't have anything that they need at this time. So we don't anticipate they need anything within the next 30 days or the next year. Sometimes we have a lot of families that are on the list, actually when they were born, newborns. We have had people call the day the child was born from the hospital, add me to that list. They don't necessarily need anything right now, but you know, they heard about it and they wanted to be on there in case they needed something when their child was like 18 or something. They were trying to be proactive. Well, under this new rule, you won't be able to do that anymore. So say we do an assessment on a child or adult, whoever, and we say, okay, based on the outcome of this assessment, we don't see that you have any needs right now, so you will be removed from the waiting list. But if anything changes, please, please, please call us and let us know so we can assess again. If there's a significant change, your situation changes, let us know, and then we can reassess you at that time. So just because we're saying not right now, so we can address the people who have something going on right now, we're not saying never. And that's what we want people to realize. We're here. The county board's here. We're not going anywhere. We just want to be able to distribute our resources to those who have a higher level of need right now. Now, while this is on my mind, I want to tell you guys, so say you are assessed to have a need. There are several criteria that the assessment's looking at. Whether or not your caregiver can continue to provide care, you know, do you have supports during the day, just different type of things. So say a person, we're going through that assessment, and a person meets all the criteria. They're just needing help in all areas. The new waiting list rule it places people based on their level of need and then date. So if you have a person who meets 5 areas, they would be higher on the list than someone who maybe only has 1. because we need to address that a little faster. Now, if you have people who have multiple people who meet the same number of criteria, so you have 2 people that have 5, then it goes by date. So the person with the earlier date that has 5 would be a little higher on the list. Does that make sense? Okay. So we do know that people may not agree with the determinations that are made. And so in those cases, you will be issued due process or your right to appeal. And we want people to have that. So if you don't agree with the determination, you have that right. We actually provide you, even if you're placed on the waiting list, we still provide you with due process because we're saying we can't give you a waiver right now. We're saying no to something, and we're placing you on the list. So you get due process if you don't agree. You get due process if you're placed on the list. You get due process if you're taken off the list. Everyone has the right to express concern if there is some. Now, some people totally agree. Like, I get it. I don't meet the criteria at this time. I'm fine with that. So you don't need to do anything with it, but you will be provided this information. But for those who do want to, have a second look or have someone else take a look at this, you have that right. So what's next for you guys? So if you're on the transitional list, if you're on the waiting list prior to all of this, you should be. But if you're unsure, meet with one of us after and we can look and make sure you're on there. We will be calling to set up times to complete your assessments. Now, the assessments can occur multiple ways. It's really going to be depending on the families and what your availability is. We're flexible, but it can be face-to-face, phone. We can come to you, or some people prefer to come to our office. You can do that as well to kind of go over this assessment with you. What I am asking everyone to remember to do is if your address changes, your phone number changes, anything like that, please let your service and support administrator know. If you don't have one, please call our intro or intake team and let us know so we have accurate information to be able to reach you. Because what occurs is if we attempt to reach you, and we send certified letter, we do everything that we can to try to reach people, and we can't, then that person would be removed from the list. Now, if they resurface later, you don't get that date back. So if you had a true need, we want to assess you at this time so we can make sure we place you in an appropriate place and we know, who we actually have waiting. So you'll start getting those calls soon. Again, if you have a service and support administrator, you'll receive a call on or around your next span time from one of us. And if you do not have an SSA, we will contact you. We have until December 31st of 2020, and we hope to get it done before that. We're going to be working very hard, but the reality is there's a lot of people that we have to assess. Do not worry, again, that if you don't have your assessment today, you're going to miss out because the only waivers we're giving out during this time are those immediate needs. Some important takeaways from today. Each person that's on the waiting list as we know it will need to be assessed to determine whether or not you will remain on the list or whether or not you might not at this time, but maybe you will later. So everyone will need to be assessed. And just so you know, in case someone asks you, even people who aren't on the list now that want to be on the list in the future, they'll still have to have this assessment. It's not just people who are waiting. This is anyone September 1st on will always have to have this assessment. The only waivers that are being allocated during this transition are immediate needs, so don't worry that someone's going to be placed above you. You'll no longer be waiting for a specific waiver, so there will no longer be 3 lists. There will just be one, and the team will look at what your specific needs are and which one will best meet that need. It may not be an IO waiver. I'll say that because we just know in the past that's just the conversation. People wanted an IO, and that wasn't necessarily what they needed. Some people do, some people don't. The waiting list as we know it in the future will only be composed of people who have a current need. It's only people who are assessed on the statewide tool to have a current need. Anyone else won't be on there. So there won't be people who are planning, trying to plan for the future like years and years from now. It'll only be people with a current need, which means they are anticipated to have some type of need arise within the next 12 months. Immediate needs don't even go on the list, because if it's really an immediate situation, we need to be addressing it. So we're not putting them on the list. So having a current unmet need, so you're assessed to have a current need, does not guarantee waiver enrollment within 12 months, because there may be other things that we can tap into in the meantime, and we have to make sure that we have the funding available to be able to give the waiver. Just because you're not assessed to have a need now doesn't mean that you never will. So the county boards are here to help. So if something changes, we really are relying on you to call and let us know. Again, a lot of times if you have a service and support administrator, that's someone that you're in contact with regularly. However, many, many people on the list do not have that. So we are really relying on you to let us know if something changes. Another thing that I want you to remember is a waiver is not the only way to meet a need. So there's other things that we could do. There may be local resources that we can tap into. There may be something that you can get through your insurance. There may be all types of things. We're going to explore all of those things first prior to enrolling a person on a waiver. If a need can be met another way, then we need to do that, and then the waiver would be the last source that we would go tap into. That means that it can't be met any other way. All right, so we're wrapping up. So, resources. I know that this is a lot of information. However, there's a coalition that kind of developed from that work group that that I described earlier, and we want questions. We want to be helpful. So they actually have a website. It's www.fixthelist.info. So a lot of the information I provided today is in there. Some greater detail. There's videos, testimonials from families, just saying, what they didn't like about the old way and what they wanted to see it happen with the new list. And we took that into consideration when developing this. We knew what wasn't working, and we tried to put something in place that would eliminate those issues. So I really, if you have not, would encourage you to go to this website. If you haven't already, maybe it's been a couple of months now, but when we started doing this a few months ago, we sent out these big postcards. It looked like these same colors, the Fix the List logo and all that, just kind of giving you a heads up about these changes. We don't want anyone to be surprised and say, we didn't know about this. We've been trying to get ahead of this for months, which is why we're doing these sessions and everything, to give people a heads up to know what's coming. So we sent those postcards out as well. Fix the List is also active on social media. So if you're a person that uses social media, if you go on Facebook, Twitter, or Instagram, they have pages on there. They update, provide posts, information on there. Our agency has sent out, and you should have received by now, we sent out a mailing, and it included a letter about some of the changes that were coming. It included the flyer for these sessions, the Waitlist Wednesdays, and frequently asked questions. So that frequently asked questions document is actually from the Fix the List website. I think it's a really good tool to kind of give people an idea of what's coming and what the changes are. So you should have received that by now. We've been doing this Waiting List Wednesdays since July, and we'll continue through the end of this month. This is the last morning session, but next week and the week after, we have 2 evening sessions. I know sometimes people need evenings. So we try to do all different times of the day to allow it to be placed in everyone's schedule. So if you know of another family that didn't hear about this or could benefit from hearing this information, please share. It's not a secret. Share it with the world. We want everyone to come here. We want this whole room to be full. So we want people to kind of know what's happening. So, if you know what's happening, that hopefully they'll lower anxiety. So these are all the resources available to you. If you get home and say, what did she say about that one topic? You can go here. And also on the Fix the List website, there's a place for you to type in questions and send it, and it'll actually go to one of the people on that group, and they can respond back to your specific question. Okay. So that's all the information I had. Questions?